nice because I did my training here as well from 2011 to 2016. But I also think that there's just such a good quality of life here, you know, between the resident and physician or attending interactions in terms of the quality of the cases, the breadth of the cases, how much the residents are involved in the cases, cost of living, and you know, just the 3-hour radius around Augusta. There's so many places to see, you know, between Charleston, Savannah, Hilton Head, Atlanta, Charlotte. The quality of life for a 5-year residency is phenomenal, and we train good urologists. You know, we send them out to fellowship, we send them out to private practice. If they're in private practice, they're the busiest in their groups, and you can get any fellowship you want from this program.
So residents who come here are going to enjoy two things, in my opinion. They are going to enjoy a well-balanced program that has all types of training needed for a successful resident. We offer a big variety of training when it comes to robotic surgery, of course, open surgeries, and laparoscopic surgery, as well as endoscopic surgeries. So by the end of their training, we are producing very competent and very skilled surgeons. In addition, residents who are interested in research will be able to enjoy a productive environment that encourages research. We have different PhDs, MDs, who are really interested in doing urologic research, and the residents can have that opportunity. Now, living in Augusta, in my opinion, is very convenient and very nice place to live. Augusta has a nice weather, has a very affordable cost of living, and at the same time is a cosmopolitan, diverse city, and offers lots of amenities to its citizens.
I think this is a sleeper program, so we're not well known in a lot of different circles. However, when you are looking at our pedigree, so the people who have come through this program as residents, who have taught here as attendings, and see the legacy that we have built here, I think it's a absolutely fabulous program that you'll be able to get enough experience as a resident to go directly into private practice, or if you wanted to pursue a fellowship, we have enough clout to get you a really good position.
Sure. One of the bigger things that I say about being here is that we're a family. We really treat each other like family members, and I like that. We're also a young family, and that's important to understand. We have a lot of young faculty here who are very, very engaged in the residency process and really want to see this program grow, and our faculty is growing. We just added 2 new faculty members at the VA. We added another faculty member here. Dr. Clausen and myself are starting to head up the residency program, and we're really, really looking to the future to make this bigger and better. As I brought robotics, pediatric robotic cases to here and did the first one in Augusta. And we just keep on pushing the envelope to making it the forefront of urology.
Well, Augusta University has a huge patient base, and also interestingly, since we are pretty much a referral hospital for the state, we see some of the most complex, some of the sickest, some of the most unusual diseases that I think that you can find just about anywhere. Just as one example, the incidence of cloacal exstrophy is about 1 in 500,000, 1 in 400,000. We've seen 4 in the last 5 years. So that's way above any other institution, unless they're a referral for that. Perhaps more than any place except maybe Johns Hopkins. And we have also the ability to not only do robotic surgery, minimally invasive surgery such as laparoscopy, but also open surgery. And not only that, but we're able to integrate those things with each other and use it to the best care of the patient, but also for the best training for the resident. So I think that those things are something that are not really available everywhere. And I think that we have been able to hone those skills to the point where I think it maximizes resident learning benefits.
It's a program with no fellows. The residents get to do all the cases. The faculty are all here because they love to teach. Nobody's here to take all their patients and do all the operations themselves and not share any in the caseload. I think it's a unique personality of the program that the resident teaching is the priority rather than the research or making money or some of these other things, which are priorities, but the resident teaching is right up there with it, and that's not true in a lot of places.